Hi, my name is Alexis Winnie, and I will be doing case study 49, Major Depressive Disorder. Major depressive disorder is characterized by a persistent, unpleasant mood that can vary in intensity and often is recurrent. The average age of onset is mid-30s, however, the average age has been decreasing. According to the World Health Organization, approximately 280 million people in the world suffer from depression, leading to 700,000 suicide-related deaths a year. Treatment for depression may consist of cognitive behavioral therapy and interpersonal psychotherapy in combination with antidepressant medications such as SSRIs and tricyclic antidepressants. It has also been found that individual therapy with group therapy has been beneficial. This is a graphic online describing signs and symptoms of depression. Some of these being low self-esteem, low mood, insomnia or hypersomnia, restless, agitated, or irritable, feeling guilty, to name a few. In the case of Mr. HB, he is a 75-year-old married white male. States, I don't know how much longer I can go on like this. I've been down in the dumps for years and it isn't getting any better. And I don't believe that life is worth living anymore. He lost his first wife 19 years ago and they were happily married for 27 years. He has a 15-year history of intense sadness, loneliness, and guilt that have lasted weeks to months at a time. Currently in a stressful marriage of 17 years. Question 1. Identify 3 major risk factors that have possibly contributed to depression in this patient. Death or loss. He lost his first wife 19 years ago, and they were married for 27 years. Divorce or strained marriage. He has a stressful home life with current wife and being forced into ending long-term friendships and selling the home he has lived in for 46 years. And alcohol use. He reports 1 to 2 beers several days a week. Question 2. Does the patient satisfy all of the diagnostic criteria for major depressive disorder? According to the DSM-5, a patient must exhibit at least 5 of the following symptoms. Subjective report of depressed mood for most of the day, loss of interest or pleasure, weight loss or gain, insomnia or hypersomnia, psychomotor agitation, fatigue, hopelessness, decreased concentration, and suicidal ideation. Yes, Mr. HB satisfies the diagnostic criteria for major depressive disorder due to the following symptoms he has reported. 1. Expressing thoughts of hopelessness for the future. 2. Insomnia. 3. Increasingly depressed, sad, and lonely. 4. Memory and ability to make simple decisions are deteriorating. And 5. Passive suicidal ideation statements, such as, I am ready now to give up the fight and be with Kay. Question 3. Should hospitalization be considered for this patient, or should outpatient treatment be adequate? Inpatient hospitalization should be considered for Mr. HB in order to possibly treat his depression with a medication trial, as he has not been on any antidepressants, and establish outpatient providers to continue an individual therapy regimen outpatient. He is at high safety risk to himself with increasing suicidal statements and access to firearms in the home. Question 4. Identify a minimum of 7 clinical manifestations that are consistent with major depression in this patient. Suicidal ideation, hopelessness for the future, insomnia or trouble sleeping, impaired memory, difficulty concentrating, loss of interest and lack of pleasure, fatigue, and the clinic reports he looks visibly tired. Question 5. Is bipolar depression a reasonable alternative diagnosis in this patient? Bipolar depression is described as episodes of elation and irritability or mania, with or without episodes of depression. No, Mr. HB does not fit the criteria for bipolar depression. He denies periods of extreme elation or irritability that alternate with periods of sadness. Question 12. Provide a reasonable justification for determination of serum GGT in this patient. A healthcare provider may order a GGT lab to help diagnose a potential liver disease patient or bile duct issues. They may also order this to screen for alcohol use disorder. Mr. HB reports at the clinic that he has been drinking 1 to 2 beers several days a week. Normal range for GGT in adults is 5 to 40, and Mr. HB's result was 38. Current research on treatment for depression includes transcranial magnetic stimulation. This is a non-invasive form of brain stimulation. TMS devices operate completely outside of the body and affect the central nervous system activity by applying powerful magnetic fields to specific areas of the brain that we know are involved in depression. Transcranial magnetic stimulation is a recently developed method of treatment in psychiatric and neurological disorders, and it is gaining popularity. The FDA has only approved this therapeutic treatment in major depression and OCD. To the left, there is a graphic describing how the TMS treatment device is used and the systems in the brain that it works. Approximately 50% to 60% of patients that have had little success with medications have found transcranial magnetic stimulation to be beneficial. About 1/3 of individuals who try TMS go into full remission from their depressive symptoms. It is important to note that TMS may not be a permanent fix for depressive symptoms and may return 1 to 2 years. Unlike electroconvulsive therapy, this approach is less invasive and does not have serious and long-lasting effects. However, before trying TMS as a therapeutic intervention, most providers recommend a series of medication trials before approving this treatment, such as SSRIs, SNRIs, atypical antidepressant, tricyclic antidepressants.